So does it mean that when a patient or when someone visits the doctor to complain about a constant headache, does that mean the doctor might not be, he or she, the doctor might not be able to diagnose the specific migraine?
I mean, it is partly correct. It depends on who you see. So a neurologist is probably the best person to diagnose the type of headache you're experiencing. And migraine is generally not a constant headache. You get these migraine attacks.
Yeah, periodically.
Correct. And these attacks can also be made worse with stress and other factors.
Okay. What about alcohol?
Absolutely.
Drugs?
Absolutely. And if you are having these attacks, so say 15 to 20 episodes or headache days in a month, then we start to think about, okay, we need to give a better management or treatment for this condition. One of the treatments that is commonly done for migraine is botox injections for headache. These are not botox injections that you do for cosmetic reasons. It's a very well described technique.
The first time I'm hearing that.
Yeah, so there is a 31-point botox injection around your head, and it is done every 3 months. So we're trying to see if there are better ways to treat this headache. But this is only done if your migraine headache is almost daily, it's chronic daily
Does
headache.
it happen daily sometimes?
You could get, and these are the worst cases, but if your migraine comes on once a month or a couple of days a month, it's best to manage those days maybe with painkillers.
I wanted to ask, what type of painkillers can the people use?
So there are different groups of painkillers. So if you have an acute migraine attack that's pretty bad and you come to the hospital, people give you oxygen. And then there are a totally different group of medications like sumatriptan, ergot alkaloids, and so on. And these are the medications that should be ideally started only by a neurologist.
Okay. Not just by a doctor, but a neurologist, a brain doctor that knows about the brain.
So it's ideally started by them, just so that we have looked at other causes of headache.
Okay.
And the group of medications are well described, and the neurologist knows which is the first line, which is the second line. And the medication varies from the medication that you take when you get these acute attacks, which is unbearable, to something that is to prevent these attacks if you're someone who's getting this headache every other day on a daily basis. And so all medications have side effects. And personally, I'm someone who does not recommend long-term use of medications. I do injections, but I do not recommend having repeat injections as well.
Oh, wow.
So the injections...
Has that got side effect or...
so like I said, we're not so good people. We do things that can cause harm to our patients.
Yeah, that means every medication or any medical instrument can have a side effect.
Any medical treatment, be it medications or injections, or you coming to the hospital...
Comes with side effects. Did you hear that?
Has side effects.
Side effects.
And you walking into the hospital, you might catch a bug from someone who is more sick.
To do with medical has side effects.
Correct. So if you can manage it with good diet, exercise, healthy lifestyle, provided you know there is nothing wrong underneath, it's perfect.
Okay.
But having said that, there is no reason to suffer in silence on your own. There is help out there. If the pain is having a significant impact or an effect on the quality of your life, get an expert to explain the options you have.
Okay.
And then you think about these options, you weigh the risks, the benefits, and you decide how you want to go ahead.
Okay, thank you. So we've had about headaches, we've had about